Hello, my name is Vanessa Sabio. I'm one of the health educators here at Jersey City Medical Center. Your name is Lena, correct?
Yes, my name is Lena.
Hi, very nice to meet you.
Nice to meet you.
So it is my pleasure to meet you today. So first I want to begin about and tell you a little about what I do here at the medical center. So my job is solely to make you understand why you're here, which infection you've been diagnosed with, how you caught the infection, how to get rid of it, and how to prevent getting it again in the future. So because you tested positive to chlamydia, we're going to be talking about very personal issues related to your life. So I'm going to ask you about all the people you've had encounters with over the past couple of months and what kinds of contact you've had with them. So first and foremost, I just want to say that I'm not here to judge you. My job is solely to make sure you make the best decisions for yourself regarding to how to manage and treat your infection. Together, we're going to create a plan for you and I to make sure your infection is cured and reduce your risk for becoming infected again. I just need you to be completely open and honest with me. The only way I can help you is by telling me exactly what is going on with you. So together, we can come up with an action plan and treatment that will work best for you and help you get better. I want you to understand this is completely confidential, and anything you say during our sessions, along with your name and anything else said, will not be shared with anybody. Do you understand, or do you want me to clarify anything?
Yes, I understand everything that was said.
Okay, great. So Lena, how about you tell me a little bit about yourself?
I am a 30-year-old accountant. I have been depressed for the last couple of years due to my bad string of relationships. I would like to be in a long-term relationship. However, things never seem to go that way. I am currently in a steady relationship with my boyfriend Rich, in which we have been sexually active for a while.
Okay. So tell me what brings you in today.
Well, since I have been with Rich, things have been drifting apart between us, me and him. So last week, I met a guy from work. His name was Trent.
Okay.
We clicked, and he asked me to spend the night with him at a B&B. The sex was amazing. However, a couple days later, I noticed a thin discharge, and I had a slight irritation when I peed.
Okay. So you've been tested for anything?
Yes, I was tested for chlamydia, and it came back positive.
Okay. I just want to make sure I understand everything. So you noticed a slight discharge and experienced a slight irritation when you urinated. Is that correct?
That is correct, yes.
Lena, you seem a little uncomfortable about this.
I'm just disappointed in myself, and I feel ashamed that I have to come here and talk to you about this. I just don't understand what went wrong and why nothing ever works in my favor. I try to be in a committed relationship, and once I feel something flaky, I self-sabotage. And what worries me the most is that I'm not quite sure who I got it from. I have no idea if it's Rich or if it's Trent. And since the test came back positive, I'm concerned that I may have infected one of these two guys.
Lena, I know what you're going through. I was also in this situation before. I've gone through multiple relationships, and I know the embarrassment you're feeling. I was very much ashamed too. However, getting the treatment and making sure my sexual partners knew as well helped me deal with what I was going through. Yes, I made a mistake, but not taking the preventative measures during sexual activity. But once I knew what was going on, the worst was over. I took my medication that was needed, and I created a self-love image to get back up on my feet, and I know you can too.
Thanks for telling me that. I feel a lot better about the situation.
Not a problem. Now, the doctor prescribed you antibiotics. You need to be sure you're taking the antibiotics as doctor indicated. We don't want you to risk not taking the antibiotics because you can develop further complications.
Yes, I understand.
Okay, awesome. So let me tell you how to take your medication. So the doctor prescribed you azithromycin. you need to be sure you are taking one pill twice a day for 7 days. So basically taking a tablet before you leave for work. And once you get back in, so you're taking a morning pill and an evening pill. The important thing about this is that even if you feel like you're not seeing any more discharge or you don't feel any more irritation when you urinate, just be sure you're taking it for the full 7 days as a doctor indicated, because then, you won't be experiencing any further complications. So tell me what time you wake up and what time you go to sleep.
I get up at 6 a.m. and go to bed around 10 or 11 p.m., depending on my workload. Your suggestion actually sounds perfect because I can work in the morning routine and bedtime routine.
Perfect. So I'm going to write this on your envelope. So I know you must return to the medical center in 2 weeks just for a follow-up appointment after completing your treatment. I would also like to do a follow-up with you no later than a week from now. How does that sound?
I can come back during my lunch on Friday. Does 1 p.m. work?
That sounds perfect. I'll put that into my calendar. Now, I know this is a lot of information for you to remember. So would you briefly tell me what I'm expecting for you in a couple weeks?
I first need to be sure that I'm taking my medication as planned twice a day for 7 days. I will come back here on Friday at 1 p.m. after my medicine has finished for my follow-up.
That's the plan. Now, for future references, if you do suspect that you have been infected with chlamydia, I need you to stop having sex with your partners. Come back into the medical center immediately just to get tested. You should bring a friend or a family just for a little bit more support.
Should I wait until symptoms develop?
No. So you shouldn't wait to see any symptoms develop. In some cases, chlamydia can actually be similar to a common cold, so you can experience a fever. And sometimes it is asymptomatic, which means that there's no sign of symptoms at all. So essentially, it would be best if you feel like you've been infected just to catch it as soon as possible.
I understand.
So based on what you told me today, there are a few things that might work for you to just reduce the risk factors of getting the infection again. So whenever you are ready to have sex again with any of your partner, you should just be sure that you're using protection. Condoms is the best way to get prevented from any infections and risk your exposure to any of your sexual partners.
Well, I tend to get irritated using condoms that are made with latex, so that's why I don't use them. However, I think it's time I invest in non-latex condoms to be on the safe side.
That sounds like a great idea. Just be sure to read the box labels and make sure that they are completely non-latex just to avoid any irritation.
Thank you so much for your time. I really appreciate the time you took out for me.
You are more than welcome, and I'll be looking forward to seeing you Friday at 1 p.m.
Yes.